It's the COVID news we all fear.
3 residents at a Sydney-aged care home
have tested positive to COVID-19.
All have now been transferred to Westmead Hospital as a precaution.
They're all very comfortable.
Fortunately, all 3 residents aged in their 80s and 90s have been vaccinated and are not displaying symptoms. They are said to be in good spirits.
We're doing everything we can to ensure that infection control procedures are in place.
The facility is in full lockdown and additional workforce supports have been activated and testing of all residents and staff has also been activated.
But with 2 staff members also positive and one of them confirmed as the source of the outbreak, one persistent frustration has returned.
I'm unclear as to whether they were both vaccinated. I think one of them wasn't vaccinated, but I don't have confirmation on that.
Although the facility can boast
96% of our residents are vaccinated.
only a third of the staff are, and there are no plans to vaccinate the rest until this outbreak is over.
We've been advised that to do it now is of no benefit to anyone, and if anything, it might mean that they suffer from some side effects of the vaccine and we lose more staff.
While National Cabinet has agreed to mandate vaccinations for nursing staff, that won't come into effect for more than 2 months. Today, the question is whether we can wait that long.
Yeah, well, I think the answer to that question is probably no, isn't it?
Yeah.
I think, a month ago, this was 4 weeks ago, we found out that 10% of aged care workers across the country had been fully vaccinated. 10%. Now, those figures may have changed in the last 4 weeks, but to have it be at 10% after all these months after the rollout, when they were supposed to be the priority demographic to get vaccinated, it's like, what is going on?
Yeah, it clearly needs to be mandated. I mean, touch wood, you don't want to speak too early, but the good news is that with the residents having been vaccinated not yet showing symptoms, that's hopefully a good sign going forward because most are at least vaccinated.
That's the thing, every step of the way with this is just fingers crossed.
Yeah.
Anyway, meanwhile, on the other end of the age spectrum, there are fresh calls to prioritise kids in the vaccination rollout. It comes as schools grapple with the highly transmissible Delta variant that is at least 50% more contagious than previous COVID strains.
Dr. Norman Swan is here to share his thoughts on this. Doc, we've been told all along that kids are reasonably safe from the impact of COVID. Has that changed?
No, it hasn't. The younger you are, the less severe the disease, although young people do suffer severe disease, but they're also spreaders. They do get infected and they do spread. And what's going to happen here is that as older people are immunised, then and at high levels, then the virus is going to find new people to infect. I mean, the virus is programmed for survival. So it will shift downwards in age, and that's what you're seeing. I mean, already young people in their 20s and 30s were a dominant group getting infected even with the old variants of the virus. But now the virus will move down into those groups. You're already seeing that internationally. And then once the 12, and in order for us to get herd immunity and get a reasonable level of immunity in these stages, whatever they are, that the federal government has announced, then we're going to have to immunise 12-year-olds and above. And I hope the TGA is very close to approving that. They have approved it in other countries. And then once that's done, once that group's done, then you'll see it almost certainly shifting down into more primary age kids who will not get seriously ill because of it, but they will be spreaders and they will need to be protected because if vast numbers of them get infected, a small number will get seriously ill. So what you're hoping here is less virus around because 12 years and above are immunized. That's a protective mechanism, but also kids are going to have to be protected. Who knows when, but sometime in 2022.
Dr. Swan, we're seeing more outbreaks in schools in New South Wales. As you said, we don't have a vaccine approved for kids under 16, but other countries do. What are the risks of not vaccinating kids?
Well, the risks are, well, first of all, the Pfizer vaccine, and I think Moderna shortly they're both approved for above 12 years of age. We haven't done that, but we don't have the supplies yet anyway. So the risks are that although the risk per young person is low, if you get very large numbers of young people infected, there will be a lot who will become unwell and seriously unwell as well. So it's dilute, but if the numbers are large enough, the numbers can grow. And we all saw pictures of younger people getting infected and indeed dying we're not talking about primary age kids, we're talking about older younger adults when we saw particularly the United States outbreak and the British outbreak. So plenty of young people got into strife. It's just not as many proportionately as the elderly.
Dr. Norman Swan, we appreciate your insights. Thanks very much for joining us.
Welcome, PBL.
Staying with COVID news, New South Wales Health Minister Brad Hazzard was slightly overdramatic with his statement today.
But right now, the most dangerous place is actually our homes. Aussies tend to think of their home as their castle, but right now it can be COVID central.
Brad Hazzard really living up to his name. Thanks. Great to know that. Nowhere is freaking safe.
I mean, what does he want us to do if our homes become COVID central? Where do we go?
The health minister then gave this rather intimate health advice.
If you do have the need to go to someone's home, it would be very wise for you to avoid kissing, cuddling, closeness, any proximity at all.
Yeah, that was Health Minister and sexologist Brad Hazzard.
So it used to be, oh, darling, I've got a headache. Now it's, oh, darling, I've got a Brad Hazzard. Back after the break, don't go anywhere.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.